I'd like to introduce Dr. Bronson Ray, who is the first professor of neurosurgery at Cornell University Medical College and served in that capacity from 1945 to 1971. Dr. Ray was the last resident for Dr. Harvey Cushing in Boston, and the point of the interview today is to find out a little more about his experience working with Cushing at that time. Bronson, how did you get from Fort Wayne, Indiana, into neurosurgery and then to Boston?
Well, I think I had always planned to be a doctor from childhood on. My father was a doctor. Several uncles were doctors. And it never occurred to me that I would do anything else, but it was only later that I aimed towards surgery and then neurosurgery. I went to Northwestern, where my father had gone to medical school, and there I got interested in the nervous system, anatomy of the nervous system, and in clinical neurology. Then I spent the first year and a half in the university hospital there when I graduated, and a good deal of that time was spent with Dr. Knavel, who was head of surgery and had been for years the man who'd done the important neurosurgery in Chicago. Knavel was a member of the original organization, the Society of Neurological Surgeons, that was organized in 1920. But he, like many of the men of his age, had planned to have a younger man take over the neurosurgery. And in this case, it was Loyal Davis. Loyal Davis and I had become friendly, and I worked some with him and with Dr. Knavel during my first year and a half out of medical school. It was these two men that arranged for me then to go to Boston, where I came in contact with Dr. Cushing as I took on a residency in surgery.
Well, what was it like being a house officer under Dr. Cushing?
Well, there were a limited number of house staff in those days. There was a limited number of house staff in those days. We came on in pairs every 3 months. And I started the residency in January 1930. It was a general surgical residency, and it was understood that occasionally a man who showed interest and some ability perhaps would be pulled out of the general surgical rotation and spend his time on neurosurgery. And that's what happened.
How many residents were on the service? Were you the only one?
Yes, usually only one resident. But near the end, the last couple of years, there were a number of men who had hoped to work on this service, and sometimes there were two men. Now, in the case of the last year, Dr. Richard Light came on and was an assistant resident on the service as well.
What about interns and other people to help out? One person doesn't sound like enough coverage.
Well, the intern soon was broken in as the instrument man on Dr. Cushing's operations. That is, soon after he arrived. And he would spend 6 weeks in the job of passing the instruments from the instrument table at which he'd prepare to Dr. Cushing. There were some men who had had little or no experience in the operating room who would start out with this kind of a job, and they found it particularly difficult. The saving grace was that Dr. Cushing was always reasonably tolerant of such men and of their difficulties in getting started. He could be a stern disciplinarian, but he was also considerate.
What kind of operations did he do besides brain tumors?
Well, he did very few cases other than brain tumors, because there were enough to fill the schedule, and we did virtually only one operation a day, including Sundays. Now, it didn't work out that there were enough brain tumors, I suppose, to permit operation every day, but there were about 200 brain tumors, I think, that last year. Now, the only other cases that I can recall that he would do would be an occasional cord tumor, maybe a subdural hematoma. He rarely, that I can recall, did an operation for tic. Of course, in those days, there was no operating for hydrocephalus or for epilepsy or for discs or for aneurysms. At least one case, however, that I can recall turned out to be an aneurysm, was a very large frontal lesion that had become thrombosed and was regarded as a tumor as well it might have been. But there was no angiography done either at that time. Of course, no myelography. We did many ventriculograms, but almost never did a pneumoencephalogram.
Can you describe the procedure in the operating room, the anesthesia, the skin prep, the ritual associated with an operation?
Relatively little conversation or talking in the operating room. It was a quiet room. The resident almost never did a craniotomy himself, but the opening and the closing of the wound was ordinarily done by Gilbert Horax, who had been Cushing's associate from the time of the war, World War I. Then about the time the bone flap would be elevated, Cushing would appear and replace Horax.
Who would then leave the operating room?
Horax would usually leave the operating room and do whatever his chores called for. One of his chores was to take care of the tic patients that required injection who were not usually operated upon.
What did you use for skin prep and anesthesia?
The skin prep was with bichloride and alcohol. Patients were shaved in the operating room, and usually the whole head was shaved. Then prepared with alcohol and bichloride. And we wore, all the assistants wore gloves that were put on wet in a bichloride basin. Now the anesthesia was often local, and Cushing was an expert at local. I always marveled at how well he handled children in a face-down position for hours at a time for the cerebellar operations. But sometimes we would use Averton by rectum. The days of rectal ether had passed. It was no longer used. And the only inhalation anesthetic that I can recall our using was ether. That was largely by open mask, which made it fairly safe. We did have an ether machine to blow ether into the patients undergoing posterior fossa operations who lay in face-down position.
No endotracheal tubes in those days?
No intratracheal tubes at all, none.
What about power tools and opening the head and so forth?
Well, we had a power drill, which was, I believe, was made by Muller, and he made a good many of the instruments for the neurosurgery. This drill was used by me for some years afterwards when we came to New York, but it had no guard on it, and one would tell when he was going through the bone by the sound and the feel. Occasionally those would misfire and the dura would be torn, but that didn't happen often.
What about blood loss and blood transfusion?
Well, I think that Cushing made a point of avoiding blood loss as much as he could, but he was not fastidious about it. When we needed blood, it would be given, but not until it was needed. And that meant that the patient's pressure had fallen considerably, and it was more difficult to get a needle into the vein. Now, transfusion was done in those days by the whole blood method, and we used what we call Kimpton tubes. These were large glass tubes that would hold 500 cc's, and they were paraffined on the inside to make them smooth. The tubes came down to a tip, and the tip was ground so that it fit directly into the needle that was in the recipient's arm. And the blood ran into the tube by pressure and out by gravity.
The problem of brain swelling, how did you cope with that in those days?
Well, we used quite a lot of 50% glucose, which would, as I recall it, would be given intravenously in 50 cc amounts. And we also used magnesium sulfate, usually by rectum. Both of these were dehydrating agents, but I think we were fairly well aware that there was, after a while, a rebound, but it was the immediate effect that was hoped for when either one of these was used. I think neither one is used at the present time. They had disadvantages that were proven to be more than the advantages later on.
What did you do in the afternoon after the surgery?
Well, the operation would, on the average, take 4 hours. And when the operating was over, we would have the patients brought to the operating room in one of the larger rooms, not the one that he operated in, but an adjacent one that held 2 operating tables. So it was big enough to hold 4 or 5 patients at a time. And the patients would be wheeled in their beds from their places in the hospital and receive dressings of the wound, reapplication of helmets, lumbar punctures, and consideration of their general state. So that all rounds were made with patients brought to the operating room in this fashion. And even the new patients were brought, 1 or 2 at a time, as they were worked up and ready to be examined.
Did Dr. Cushing ever take a vacation?
Yes, he always took a month in the summer, and this was usually in Europe, I think. Certainly it was while I was there. He'd He'd visit England or France, particularly. He had received honorary degrees and was receiving honorary degrees there. Usually traveled to Europe alone. Mrs. Cushing and the daughters commonly spent summers at their summer place in Little Boar's Head on the seashore in New Hampshire.
Was Dr. Cushing, much of an entertainer? Did you have a house staff over for dinner and visiting dignitaries as well?
Not all, but many of the house staff would go for a meal at his house, sometimes on Sunday mornings when tennis would be going on, sort of a round robin. People would sometimes go to that. However, if one went to dinner in the evening, he usually left in time to let Dr. Cushing take up his evening work, and he did a good part of his writing and paperwork at night, and not much of it in the hospital.
Then I assume he didn't drink a cocktail much in the evening if he planned to work at night.
No, he was not above drinking a cocktail now and then, but he didn't drink much. He did smoke a good deal, and he smoked a great deal and found it difficult ever to give it up, even when he developed vascular trouble in his lower limbs.
Had the association been made between smoking and peripheral vascular disease?
I think so. I think he had warned that if he continued to smoke heavily, that it would have a untoward effect on peripheral vascular disease.
Was he a good speaker? Or what about rounds and conferences and so forth in the hospital?
Well, he was a good teacher for house staff in that he always set an example, but he did very little didactic teaching. It was not a part of his plan to tell any member of the house staff exactly to do this or exactly to do that. And I think that was came to be a strong point. As far as many of the house staff was concerned, they learned to emulate Cushing, and it's surprising how many of them did so, even to the extent of some of his mannerisms. With students, he was quite good. He was sympathetic to a student's point of view, and he was informal in his manner of teaching, particularly if it was by the bedside with a patient to present before a student or students. But as a speaker, he was not very forceful. And I remember going to hear him give the Bevan lecture on the cerebellar astrocytomas in Chicago, and he read every word of his paper with only occasional looking up and glancing at the audience, and I thought he put on a very dull presentation. And I think he was not a very forceful speaker, but he could be quite pleasant in an informal way and instructive.
You must have 1,000 memories of your time with Dr. Cushing, but is there any dominant effect that Dr. Cushing had on your own life?
I'm sure he had some impact on my life, but there were a number of people who had impacts also. And it's not easy now to weed it out, but I found that I was impressed with his diligence, that he stuck to a problem He let very little else interfere with it in the process. I was impressed with the way he handled himself in an operating room, and I suppose that as much as anything guided the way I worked in an operating room thereafter. I've been told that that is probably true. Of course, he imbued in everyone on the house staff the need for writing some. And I think that mostly a matter of diligence in work was what I got out of Cushing.
Thank you very much, Dr. Bronson Ray. I enjoyed your comments, and between your remarks here and the famous movie of Dr. Light and others, and the biography of John Fulton, I think we have a good appreciation of what it must have been like to be in Boston in the Brigham with Dr. Cushing in the late 1920s.